Welcome back. And just before the break, Roger was getting ready to ask a question of Toni. Uh, and I think it had something to do with 60 is the new 40. Is that was that kind of where you were going?
I thought 80 was the new 40.
Okay, I
Anyway,
like that. That makes
um,
me 20-ish.
now, it's interesting, Tony, you were talking about the Hindu master that said after 40 we start deteriorating or whatever it is. And recently, I referred earlier to this video that I was watching yesterday, or this interview I was listening to yesterday, actually. And then I'd also heard Lee Carroll address this, and recently on more than one occasion, about how within the physical structure is the ability to reverse aging. And it's something that we don't believe as humans because it's supposedly impossible. But I'm starting to see this come up from different places, and I'd like to get your input on what you know or think about that.
Well, it's so fascinating to me. In an individual session, I have seen people release old beliefs and something like have an aha on another level, because when we do deep work or really go deep inside, we actually change our brainwave state. And so we're in a more receptive state, and there's some kind of a realization, let's say. They'll get up off the table and look 10 years younger in an hour just from a mental change. And then, with all the new research into the telomeres and everything in the cells, I do believe that a lot of aging can be turned back. And have you seen that research where in some other cultures they revere older people and believe that they get better with age? So that
every culture but ours.
Right. Yeah. And it's a problem because we're influenced by what people believe. But there was one culture in South America where they ran between the villages to give messages. There were runners, right? Mm-hmm. So if you were a good runner at 30, you were super good at 50. And at 60, you were at the top of your form. And that even if these people lived into their hundreds and, with no ill effect, died in their sleep, no illnesses, and got better with age. And when these researchers went down and tested them, there was no evidence of age and decay that we see in our culture in those older people. And they were weird.
Yeah. So if we're as technologically advanced as we are, we're not doing ourselves any favor with the technology.
And we favor youth.
Yeah. Well, it is interesting, Janet, because if you think about it, we're supposedly so technologically advanced, but we're so far behind in so many different ways. I mean, just look at, what we're talking about, healthcare. I mean, are you serious? I mean, for all of the things that we know, like you said earlier, just give them pills and
a bunch of stuff at the symptoms.
Right.
Yeah. I actually had a friend that had something, was getting a dizziness, and went to, said, every time I stand up, I'm really dizzy. There must be clogging in the arteries. And they checked his carotid arteries and they said, there's no clogging in the arteries. And until you have a stroke, there's nothing we can do for you. I was like, what?
Yeah, come back and see us. We're in really bad shape.
But, he consulted a medical intuitive who said, oh, yeah, your carotid arteries are fine. It's your vertebral arteries. Go back and do the test on the vertebral arteries. They did find plaquing, but the medical intuitive advised chelation therapy. And he did that and went back, got the test, and the plaquing was gone. So, there's alternatives that can work. There are times, like I'm talking about in my book with the Body Wisdom, about being an active role in your own healing. And there are many minor things that can be resolved by just listening to the message. I've been getting feedback on the book since it's been out, that just that exercise where I have them breathe in and listen to the symptom, how does it feel, mm-hmm. and then acknowledge, I know you're feeling pinched, whatever it is, and have it be resolved. It goes away because the message got through. But even with cancer, even with plaquing in the arteries, when you need intervention from outside, you need someone to help you, you can have an active role by being with it, breathing into it. What is this trying to teach me? What can I learn from this? And you'll heal much faster, even if you need treatment from some professional. So we really can take health in our own hands in that way and decide what kind of therapy treatment do I need. Your body will tell you. You don't have to guess.
You know, I was listening to two women on the ferry yesterday, and one of them was going to get a physical, and I was just like eavesdropping on the conversation, and it speaks to what you're talking about, or what they were talking about speaks to what you're talking about, in the sense that it's like what they were saying was like, well, I trust my I trusted my doctor to call me and tell me when I was supposed to get a mammogram, but they didn't do it. And so I missed a year. And when I heard that, I thought, it's like, God, everybody just looks at doctors and gives, I mean, especially like when I was growing, or when we were all growing up, and, we were taught somehow, it was like floating around. Doctors know best, trust what they say, and don't question what they say, and you'll get better.
Right. And how untrue is that?
and it's about not taking responsibility for yourself and your own health.
That's exactly it. And it's a question, I think, that a lot of us, most people I see in my workshops, can answer right away. If you ask somebody, let's say they're feeling poorly, you can ask, what's the number one thing that you should stop doing? And they know. And what's the number one thing that you should be doing that you're not? And they know. And they're right on. What you just said, Roger, take responsibility for your body and your life.
Yeah.
And it becomes it's not a burden. It becomes more interesting, and it's a fascinating life, when we take responsibility and become active in it.
Yeah, exactly.
So.
Now, let's get back to the book a little bit here, because there's some really key things that I want to talk about there. For instance, you say that the body is speaking to us through sensations, right? The feelings or the sensations that we feel within the body, and that emotions and life situations and are also trying to teach us something about ourselves. Could you explain what you mean by that?
Well, for instance, with sensation, since the body only has sensation to talk to us, that's how it gets our attention. And if my knee hurts and I just take an Advil to get rid of the knee pain, I might not realize that when it hurts and how it hurts is telling me. For instance, when it hurts, a lot of times can tell you, it's related to those really steep steps I go up every day. Maybe I need to change that. Or or how it feels can also be helping us. And then with emotions, you can know that anything that really evokes strong emotion is something that needs attention. If when people say to you, for example, oh, just calm down, it'll all be fine, you get angry, you look at it, okay.
You be calm.
Right. I mean, that is the reaction a lot of times, right? Is it the tone? Is it the person? Is it the situation? Are you frustrated, wanting to lash out? All the details about what it is that makes you angry. It's usually not the thing. It's not that person. It's something deeper that is needing, gee, I might feel like I'm not empowered in my life. Well, maybe I need to change that. Maybe I need to change my job or my relationship, or work with my relationship so that I feel more empowered. So there are usually clues, those kind of recurring situations too, that something's going on. I have a friend that every job that he took, he felt that the boss treated him poorly. He wasn't given responsibility. He blah, 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 blah. And then, it's like every job, the last 5, and then you have to quit. The only common denominator there is that person, and I started to say to him, what do you maybe need to do differently, or what is it in you that they're keeping on picking out, that you need to look at, and what's that trying to tell you? So those recurring situations can even be informative. When you're the only common denominator, there's something there to look at.
Exactly. Now, so this brings up the next question then, that these things that happen in our body or in our emotions are often metaphors for something much deeper. And what does that have to do then with healing?
Well, just discovering the metaphor, it's such a great, useful tool in our healing. A metaphor means that something is representative of something else. So, for instance, let's say I'm working with someone, they feel like they're getting pinched. The pain, when I say, what does that pain feel like? Well, it's a pinching. And then, does that remind you of anything? And they might say, yeah, the way my wife talks to me, I feel like she's pinching me all the time, and then, okay, so there's the pinch is just letting you know that you're being pinched. So there's the metaphorical representation of that. Many times it's much more complicated, but that's a simple message, just like we're saying about the emotions. If you're always getting angry or someone's always telling you the same thing, it's like that's representative of something else.
So metaphorically then, it's a representation of where maybe there's an imbalance somewhere in your life. It doesn't necessarily mean it's in the body. It may be the body that's telling you about it,
right?
But there's something else.
Right, and many times, like I was saying about when you listen, how it involves with healing is many times, first of all, if it's simple, the body will release it and you'll feel better right away. Mm-hmm. Even if it's more complicated, for example, an organ disease, and I mentioned this in the book, that first look at what that organ, what's its normal function. So very simply in one sentence. And for example, with me, I had hyperthyroidism that ended up being my thymus was irritating my thyroid. So the thymus is what tells all your cells when you're a baby, who is me and what is foreign. So that if I get exposed to something foreign, my body knows, my immune cells know to respond. That's not Toni. Let's surround it and destroy it. So I was having trouble with my thymus because I had a boundary issue. I didn't put myself first. I took care of all those other people, 70 some people a day, and sometimes I didn't even eat.
Oh my God.
Because I was confused. There was a confusion of who is Toni and who is the other person, So it's pretty interesting. So there's the metaphor of that thymus says, who am I and who are you? And I was totally confused there. So my thymus got rather upset.
So what did that have to do with the thyroid? Just that the thymus was irritating the thyroid?
The blood supply to and from the thymus goes through the thyroid gland. Okay, so the artery and the veins actually to the thymus go through the thyroid. So when my thymus was so toxic, the toxicity was backing up through the veins to my thyroid and then irritating my thyroid and making it overwork.
Wow.
That's
made yourself sick, huh?
Boy, you talk about, having a 150 pulse rate when you're just sitting reading a book. It was pretty bad. But it was my body was trying to tell me overworking. You see how I was overworking, like saying, hey, you're pushing us over the edge by what you're doing, thinking I'm helping everybody else. But, what about this side?
Yeah, giving from a deficit, which is never a good idea.
Yeah, and it was a hard lesson to learn, to, hey, I'm important too. And that's a big one. I talk about that in the book, that how one has to realize that oneself is just as important as everybody else.
Well, I would say that I would argue that it's more important.
Yes. But, yeah.
I mean, one of the things that we're taught not to be is selfish. Like if we think about ourselves first, then we're being selfish. But if we think about ourselves first, then you can give more.
Well, you know what I even came to was that because it is healthy selfishness. It's healthy,
Mhm.
you know, that I have gotten to the point where I'm not taking care of myself so I can help other people more. I'm taking care of myself because I deserve it and I'm worth it.
Yeah,
Yes.
and I call that self-centered. I talk to a lot of clients about that exact same thing, is that you can't keep giving from that deficit. It's that example of the steward or stewardess on an airplane telling you if that air drops, you got to put your own mask on first. The reason being, if you can't breathe, how can you possibly help anybody else?
Right.
Right? And if that's a sound thinking as far as I'm concerned, and that brings us back to self-centeredness. Um, and in this case, did you develop that wisdom on your own, or did someone help you come to that conclusion about your thymus-thyroid connection and what it meant for you?
Well, of course, at first, I unfortunately did not, I had emergency situations. They're called thyroid storms, where your thyroid takes over and makes all your organs work really fast and you can die. So I ended up in the emergency room a couple times. And of course, first thing is beta blockers, slow your heart down, give you medication to stop the thyroid from working. And in that, I start then taking those medications. I started exploring, looking for how can I be involved in healing this. And that's when I came across some body workers who said, "Oh, it's not your thyroid at all; it's your thymus." And then when we started working with thymus, and I looked at the metaphor, that was when I said, "Oh, Toni,
Look
who
at
is
this. And then now, how quickly did that heal after you had that realization? Was it almost instantaneous that it was just able to be released and you went back to health? Or did you?
No, it slowed down, and I had some ups and downs. Unfortunately, I found a practitioner, and along the way there, when it was bad, that was trying to wean me off the medications, and she weaned me off too quickly, and I had another emergency.
Oh,
And
Wow.
yeah, and that was I was in the ER for about 8 hours, and the doctor really set me down. He said, "Look, you have to decide," because I didn't want to take the thyroid out. He said, "You need to decide, are you gonna die with it or live without it? You are at that point. This is your 5th thyroid storm. You've been messing around with these alternative things." And, so I did have to get medical treatment to calm my thyroid down medically. And, I had to get, it was called thyroid ablation, which is to kill your thyroid. And I did do that. And now people ask me, what would you have done differently, Toni? And I always say, if I had just gotten divorced immediately, I probably would have healed.
all right. Okay, hold on. We have to take a break here, Toni.
Yeah, blame it on the other guy.
That's always the sound way to do it. All right, so we're going to take a break. When we come back, Toni, I want to go into some of the exercises in the book, all right? So we'll be right back.